that was really like what got me interested in precision psychiatry because I could see very clearly that I could have had that treatment on day one. The signs had been there, they'd been hidden, missed under the other things that were bigger problems that looked like, your heart rate is now ways too low. We need to physically do something about this, or
Mm.
all these other situations going on. But I think that's because, being hidden and there, and I know that had I got that earlier on, it would have completely changed sort of my like childhood experience. And I also know that there's plenty of people are still in the situation where they haven't got the right treatment, and it is an intolerable experience.
Dishonesty, disrespectful, discrimination, detached, dismissive. That's it. I'm done. Relationships can be messy. Are you having trouble with your personal or professional relationship? Not to worry. As a relationship therapist and coach for over 25 years, I have a lot to share, and so will my guest experts. Let's get smarter in our business and personal lives so we can be our best selves. Now, let's get on with the show. Welcome back to episode 16 of Mixing Business with Pleasure. For any of you who know me, you probably know I like interviewing ordinary people doing extraordinary things, and Amie Lighton is no different. She is the founder and CEO of Allia Health, an organization incubated by Stanford Healthcare Innovation Labs to serve those in need. She and a dedicated team are building a precision-driven mental health care system by connecting data from wearables, such as sleep patterns and heart rates, to EMR records, genomics, brain scans, and even latent vocal and linguistic cues from telehealth sessions. The team aims to make mental health care more effective, accountable, and affordable. The problem that Amie and her team aim to solve is the lack of data in mental health care and the reliance on subjective self reports, often recorded on pen and paper, or, you know what, at times, maybe not recorded at all. This leads to delays, misdiagnoses, ineffective treatment plans, and frustrating game of whack-a-mole. And as a psychotherapist, I mean, this is so true. It's unfortunately what happens when professionals aren't talking to one another, and when you don't have evidence-backed treatment plans, or treatment in general being carried out by the professionals. And like, if you can believe it, psychiatry is the only field of medicine that lacks objective measurement. So, you know, when I first heard of Amie, and Amie's journey, I was inspired to read a book by Dr. Tom Ensel, who is the former NIMH director. And the title of the book is Healing: Our Path from Mental Illness to Mental Health. And it was e extremely insightful to me. Like, I mean, it's something that I kind of already knew, but when I actually saw it down on paper, um, the everything from stats to, discussing the increasing rise of, suicidal rates, let's say from 2020 to 2024, I think it's climbed 33%. Um, when you compare this to what was seen, maybe in the decades before that, um, everything from that to, I don't know, like just like the the lack of yeah, the lack of precision mental health care, the lack of standard of care when it comes to mental health. I mean, as I said, I already sort of knew this, but reading his book made me not be able to turn away anymore, I suppose. So when I came across this startup company and what it's founded on, um, and what it's being like inspired to create, I became very excited again about my practice. And I think if any of you are in the field of mental health, then you're also going to be very inspired by this. So, you know, after interviewing Amy, it's not surprising to me that she is has has found herself as a founder in such an endeavor. Um, and even though I consider myself very new in this whole investing arena, I know that VCs and investors alike look for exceptional founders with unique insights. Um, they're looking for the outlier in like as an individual, and basically founders who are in the top 10 basis points of a, some particular thing. Um, and I think, you know, Amy fits those describers very well. Yeah, I mean, they say that extreme personalities produce extreme results. And now that I know Amy a bit better, I see this as being no different. So I thoroughly enjoyed this interview. I think you will also feel similarly, even if you don't know much about startup companies, or maybe you're not even interested in new upcoming companies, and you know w- what what it takes for someone to come, like, to start with an idea and bring their passion behind it, and put it into something real. I think you're just going to be inspired to hear what this woman has done in her short time on this earth. So with that, enjoy. Amy, how old are you?
I'm 21.
21. Okay. And where were you born?
I was born in London. Grew up in London too.
Okay. Tell me currently, as a 21-year-old, what you like to do in your pastime, like when you have free time. What are some of the things you enjoy?
Big athlete, love sports. I think it gives you such a good feeling. So very much anything, running, swimming, sailing. I'm very excited that you can ski in San Francisco on the same day that you can like leave work on a Friday, sort of in the evening, and be skiing on Saturday morning. That is so cool. So looking forward to winter.
Oh yeah, okay. Yeah, no kidding. I've never lived in San Francisco. I live in Canada, so snow is a big part of my life. Sometimes it's good and sometimes it's not so great. But anyway, so interesting. Okay, so you and I are two peas in a pod, because I have to be doing something activity-wise every single day outside, unless, I mean, otherwise I would go insane. So yeah, we have the same pastimes. So what how would you describe your okay, how would you describe, like, what characteristic traits would you say were most influential um towards being where you are right now as a founder of a startup company?
First thing would be intuition. Um,
Hmm.
big I think your intuition can tell you so much. If you lean into it, then it tends to lead me in the right direction. And I think when I find that I'm not following my intuition, then I sort of always look back and think, oh, it was kind of right. Sort of that was right all along. The second thing is it's not exactly a trait per se, but not being sort of afraid to break the status quo and go leading with conviction. I think it's incredibly important. There's most things I think in a sort of entrepreneurial context are going to not be accepted by people, and that is why that it's something new. And it's been yeah, that's something I'm not afraid, I guess, to do. I think the third thing maybe is, and it's not really necessarily that work related, but just kindness. I don't think people have to necessarily be nice, but being kind is incredibly important to me.
Like, have we been reading the same literature or like I think you're a mini me. Like it's like you
Such a
answered
compliment.
it's well, no. Um but well maybe if the tables turn someday and you start interviewing me then we'll see. But no, it's really interesting because the things that you mentioned like are many of my where many of my thoughts were in the last week in terms of what it means to be a nice person and what it means to be a kind person and how they're very different.
Mhm,
And not following the status quo and working through life like with conviction, where I like to think of it as sort of the law of assumption. What you assume becomes your reality, and how so much of our behaviors are really running in our subconscious. So we might as well consciously assume what we want, rather than, for our subconscious to take over, which ties into the intuition part. I mean, honestly, sometimes, and I speak about this quite a bit, like in terms of relationships, because I do help a lot of people with their relationships. And it's sort of like this, it seems like, people want to draw such a dichotomy in terms of, the way a man thinks and the way a woman thinks. And it's very, what's the word? Absolute, either or, but like the best individual has qualities of both. And I mean, a lot of people, like when you speak of intuition, they would say, "Oh, that's more of a female quality that you might have, like their gut intuition, basing decisions off of emotion." And literally, like this afternoon, I was just thinking so much about that and saying, there's a time and a place for a man or a man's way of thinking, especially when it comes to business, but there's also a time and place for, where maybe less logic, less reasoning, if I were dare to say, and a little bit more emotion or intuition. And yeah, like both are necessary. Both are necessary. And that's what makes a good relationship and a good team and a good business, do well. So I love what you just said. Um, So, okay, so here we have this 21-year-old, UK born and raised, more or less, who is now spending quite a bit of time in San Francisco, enjoying the outdoor life, but running a startup company. How does this happen? Like, how does this happen? Oh, I can't hear you. You're muted. Yeah.
from being in the Bay Area, I've noticed that, like, I mean, every person is like a Stanford dropout, and it's sort of it's a very, like, normal course and trajectory sort of for people to go on. I don't think the same could even vaguely be said about sort of like Oxford, or just the UK more broadly. Something I really admire about America is the sort of attitude of just like forward thinkingness and like getting on with it. But it definitely sort of not that same environment back home. So I didn't really know what a startup is or was, sort of like 2 or so years ago. I didn't really see the difference between like a small business and a startup. I guess I could have had a guess about what one could be. And so it sort of really came about sort of just sort of by chance. had run a couple of sort of small businesses that made like neat side money. They still do. It's quite enjoyable. You set them up, they take 2 days to set up, 3 days to set up, but once they're set up, then it's fairly minimal effort. And so I had sort of done that sort of thing and but really knew that what I wanted to build in the context of sort of behavioral healthcare and psychiatry. I think there's a massive gap. And then sort of realizing how what one wants I wanted to sort of saw as a vision, the way to get there was by building a startup. And so it was kind of by connecting the two, it was sort of there was only one option. And hence here I am.
Wow, but, like, but how do you make the connections? Like, I'm just thinking, like, the type of, company that this is promising to be, for, Allia Health is very tech-based. I mean, we're talking about, like, um, a platform that gathers incredible amounts of data, health data, um all in the name of precision mental health medicine. So, like, how do you make those connections with the right people, though?
There's sort of two parts to that. The first is from like it having to, the mentality of it has to be a startup. I don't think that we haven't seen it from academia. There's been sort of immense amounts of money that have been put into precision psychiatry, and whilst some sort of incredible work is going on, I think there's a need to bring the translation piece is beyond important in this context. Not only providing sort of better data, but also from the perspective of like making it relevant in the real world, and sort of serving patients now and today. So that was, I guess, like the first realization. In terms of making connections, I think I have no shame to cold emailing. And so I think people are surprisingly happy to help when you ask. And just saying you're a fan and asking for their help, and people will get back to you. And even if 10 ignore you, then the 11th person won't. And yeah,
Wonderful.
that's
I
the
mean,
process.
this is common. Like, when I talk to very successful people, is like, yeah, no shame emailing, cold emailing. So, who can I ask? Who was the first person you contacted when you thought about your mission to change the trajectory of mental health treatment?
So one sort of the first sort of problem per se that I realized was the issue with the DSM-5. For those who don't know, the DSM-5 is sort of the diagnostic manual that is used in psychiatry. It's arguably not very accurate at all. I think it's about 20% accurate would be an optimistic guess.
Yeah.
Perspective, there's over 10 million combinations of symptoms within it. And I think in the most part, then there's sort of unanimous agreement almost that this isn't great. The question is more, okay, so what do we use instead? And so a couple of people have started to delve into this, and there's sort of two core academic groups. One is called the HiTOP Consortium, which stands for the Hierarchical Taxonomy of Psychiatry or Psychopathology. And this essentially, instead of like treating mental ill health as like different boxes, you have anxiety, you have depression, you have
Yeah.
OCD, it sees it as like a spectrum. And
Yeah.
then you're not just in a box.
Yeah.
Realistically, that's not going to be the case. So I connected with one of the organizers or the directors there, Dr. Catherine Jonas. She also runs a lab at Stony Brook University. And her sort of main work is seeing, okay, we're not finding genomic markers between if we take like a big category and then finding sort of genomic markers between a big category and like schizophrenia or depression. But could we, if we made it a lot more granular and looked at like and saw it as like a spectrum, now can we find genomic markers? And I think that's super interesting. Um,
Yeah.
so yeah, that was the first person I connected with.
Okay, interesting. And yeah, this makes me so excited as a psychotherapist because it's very much in alignment with what I studied um in terms of functional medicine. Like,
Yes, yeah.
yeah, yeah. So about, I don't know how long ago now, 4 or 5 years ago, I just thought, you know what? Like the functional medicine, which is root cause medicine, it just makes so much sense to me. And I just thought, not that I'm gonna start treating people in my psychotherapy practice, with functional medicine. I still went ahead and did it because I just thought it just makes sense. Like, and I just, I thought if I because it's exactly what you said. It's treating the system. It's not treating the heart. It's not treating the thyroid. It's not treating the gallbladder. It's not treating the brain. It's a whole system. And then, we put these pieces together, and it all makes a lot of sense. And I think after my training in that, it it it's in some ways I did feel like a real outlier, because I was amongst many other faculty of medicine. But at the same time, you know what, Amy, it was always related to stress, like stress, and so you could say mental health was always related to these physiological symptoms that the patient was feeling. Um, and that's what I love so much about Allia Health, because it it takes all these data points, like, and we can get to more into like the way it works a little bit later on, but it makes sense so much in terms of preventative medicine. Like, we're gathering data from when the mother came into the doctor's office and started talking about her 2 years old active behavior. And then, we might have notes from a school counselor in terms of this child having difficulty focusing in class. And now the 14-year-old comes into the psychotherapist's office and starts talking about how she is having difficulty, I don't know, or that she finds herself like sort of in this imaginary dissociative, moments where she just wants to be alone and just loves sort of this dreamlike state. And it's sort of like, and then the doctor's, notes on whatever that might be. And then you put, like, 1 plus 1 plus 1 together, and it's sort of like, oh, ADHD. It's just like it's going to make the diagnoses like so much quicker,
Mm.
because of. And then I mean, that example didn't even take into account like some wearable device that this person was wearing, whether that's an Apple Watch monitoring your heart rate variability, or your sleep score, or um yeah, I mean, it just makes so much sense. So I went on a bit of a tangent there, but like, what makes you most excited about Aliyah Health?
I think in the context of like, it's a bit selfish maybe, but in the context of my own journey, then wasn't sort of too dissimilar from the one you described. I think often like what you're showing is sort of a symptom per se. What you come into the sort of therapy office or you go to see the doctor about, it's like a high level problem. You're feeling depressed.
Yes.
Like this wasn't the case with me, but like, you're sort of drinking ways too much. And you've
Yeah.
got this like sort of very face value, okay, this seems like the problem, but it's really like the symptom of the problem. And
Exactly.
I think it becomes especially like as things get more acute, becomes harder to see, okay, this is the symptom of the problem, so we're going to treat the symptom, and then it doesn't work. Sort of whatever's like the care isn't working, and then that becomes really demoralizing for a person. You like
Yeah.
don't feel understood. It's like, okay, there's a sort of hopelessness that comes into play that, well, nothing's going to work in that case. Maybe sort of your social situation sort of starts to decrease more because maybe you can't hold down a job anymore, and all of these factors are starting to like amplify the situation. And you then sort of after many years, then someone might recognize, oh, this is the underlying issue. But by that point, then a lot of sort of challenge has been made. And I think if you can identify that at an earlier point, sort of tying to what you said around sort of preventative medicine, that would be a real game changer for a lot of people.
Yeah, and we should maybe mention your story a little bit. Like, I just brought up, where you live and where you're spending most of your time now, like, in Silicon Valley, more or less, and at the startup company. But just noting your age and how young you are, and how you are a founder of a startup company, like, as robust as I see, Allia Health becoming. Really wanted to bring that to the forefront, but but it's this whole idea all began really through your own lived experience, dealing with um, the crisis that's going on right now in the mental health system of, a lack of evidence-based treatment, a lack of, you know, professionals speaking to one another, um, uh, and affordability is another thing. It's just it's like completely, like, to be completely honest, like, it's as a psychotherapist myself, I often become extremely discouraged knowing that, I really at times question my efficacy of my work, not because I don't believe in therapy per se, but therapy is very important, at the right time, at the right place, um, and using the correct tools, like you say, evidence-based treatment. But it's just, I don't know, like, sometimes I feel very alone. I feel very alone, not having a network of, like, professionals that I'm working with in the treatment of this individual. I mean, it takes a lot of loops. I mean, a lot of effort and work to for me to, first of all, I need to get permission from the client to, contact their GP. To imagine getting that, GP, general practitioner, what we call, or, PCP, on the phone, like, to speak to me about this individual. I'm not going to begin contacting school counselors, or, I mean, or I don't know. It's just like, it's overwhelming. And so what I do instead is rely on the client to tell me. And that's not a great reliability source, because you don't know what you don't know, as a client. And you don't even know if you actually are stressed out. Like, how what do you base that on? If all your life you've been living in the, sympathetic state, um, and just fighting, and it's like lying all over the place. So no one even knows, like, what it means to be stressed out, because you could have completely normalized that. And I've seen that over and over and over again, until someone comes in and says, "Oh yeah, you know what? I actually saw my GP, and turns out I'm, in level 3 adrenal fatigue, and that's why I can't get up in the morning." So anyway, how did you, like, what was your experience in having the right treatment at the right time with the right people?
Think if I take it back sort of before that, then sort of about 15 or 14, my father passed away quite suddenly, which wasn't the greatest time ever. And then sort of about 15, 16, then got quite bad anorexia. Spent quite a lot of years sort of in and out, inpatient, intensive outpatient care. I'm really like, my mum remortgaged the house to pay for treatment so I could get sort of better, per se, private care. Like, really, and I was lucky with respect to that. I actually could access it. Um, However, really just didn't see almost any progress sort of at all from treatment. And you saw physical progress at times, sort of with your one's physical health, but like mentally, just sort of wasn't recovery really, really wasn't something that was on the agenda. The idea of me being able to like hold a job or being able to sort of go to university, like these were sort of things that were accepted as this is not going to happen. And it wasn't
Mm.
said so or verbalized because, but it just sort of was true. And I sort of I went on for quite a couple of sort of till I was about 19, like this, and then was incredibly lucky. I did manage to get the right treatment, and in my case, it was lucky because there was like an instant effect. And it wasn't that you were better instantly in any shape or form, but like something had worked and it had worked well, and nothing had worked in 4 to 5 years of being, I was pulled out of school. It really wasn't a great scenario, and something had worked, and you knew you were going to be okay. And that feeling is really, I think, there's something that Thomas Insel talks about a lot of hope. And that experience gave you hope for the first time in as long as I could remember, and you can't get if I'd had that all along, maybe it would have all been a bit more tolerable. Um, but that's really, and it did work. I said, sort of, I remember that day that I'd said to my mum, like, "Mum, I'm gonna be okay." And just so I sort of grinned like a Cheshire cat all day long. Not just because you were sort of inherently really happy, and it did work. Within about 6 months, I'd fully recovered. I was full-time at Oxford University, had an amazing group of friends, was back into sort of running, weightlifting, and doing all the it was so much fun because you got to do all these firsts, like going to a
Mm.
supermarket on your own was like a first, going to a museum, going to an art gallery, like going out with like to the pub, like actually very British thing there, but like all these experiences that everybody else had just had like ages ago, I'd not had. So I got to have like it was like a holiday for so it was so much fun. And that was really like what got me interested in precision psychiatry because I could see very clearly that I could have had that treatment on day one. The signs had been there, they'd been hidden, missed under the other things that were bigger problems that looked like, your heart rate is now ways too low. We need to physically do something about this, or
Mm.
all these other situations going on. But I think that's because they had sort of been hidden and there. And I know that had I got that earlier on, it would have completely changed sort of my like childhood experience. And I also know that there's plenty of people who are still in the situation where they haven't got the right treatment, and it is an intolerable experience. And therefore, sort of, I think it sounds like I hope it doesn't sound too obnoxious, but I think you really are given like no other opportunity, no other choice, but you have to go and do something about it because you know that this saved your life, and
Mm.
therefore there is, a real weight around this as a problem. Um, and yeah, hence sort of got into this more broadly.
Yeah. Yeah. It speaks so much about, the 3 Ps that Dr. Insall speaks about in his book, right? And the book, for anybody who wants to grab it, it's called Healing Our Path from Mental Illness to Mental Health, by Dr. Thomas Insall, spelled Insel. Yeah, the 3 Ps being people, place, and purpose. And now you just explained your passion behind the purpose of Allia Health, right? I mean, you're purpose driven, and that explains a lot. And um, can I can I I mean, and like your story is so sad because I'm just thinking, my God, you were robbed of you could say 4 or 5 years of what should have been some of your most, free, like happy, no responsibility, in my life sort of thing years. Um, but you got through. Now, can I ask what was the specific, like, moment or treatment that you received where you thought, "Okay, mom, I'm going to be okay."
You know what? It's very interesting, also particularly stigmatized, but ADHD medication.
Wow.
ADHD is massively underdiagnosed, and this is not going
Yes.
to be the case for everybody in the slightest. And so, sort of, I'm very conscious of that when saying this. But there's a massive underdiagnosis of ADHD, and even if we want to call it ADHD, it could also just be sort of severe cognitive challenges which result in depression. If you can't get up in the morning, you're sort of missing things, you're behind it, what like cognitive related challenges, then
Yeah.
leading to depression, anxiety, maybe sort of impulsive behaviors, etc. So we can call it ADHD or we can call it a challenge with cognition. And that was what it gave me the ability to tolerate things that would help me recover. So I could now get to therapy. I could get from bed to a therapy session, which wasn't something that was like really on the agenda before. Like, and I think that's why it was so powerful. You could go out for a walk, you could get, all of these things that are so good and we know are so good for our mental health. If you can't get to that stage, then sort of a lot of times like wider things sort of are sort of incredibly beneficial, or at least they were in my case. And I was recently at Dr. Leanne Williams' lab at Stanford, and it was a precision mental health and wellness conference, or synopsium, and a lot of their work has been essentially taking neuroimaging scans, identifying if it is there's high levels of brain activity in the area that is sort of associated with cognitive challenges or a cognitive subtype of depression, and then providing sort of non-stimulant medication for people and seeing if it helps. And they had multiple case studies of people who had tried two, three, four types of antidepressants, hadn't seen any progress, and then suddenly were able to sort of just get their life back on track. So it was super interesting being there and listening to that presentation.
Wow. Yeah, no. Did you have to I'm kind of curious to know, like, with the ADHD, medication, did you have to try a number of different medications or was it yeah.
Really good question. Um, Somewhat. I so first ones did work, but I could pretty quickly see that these weren't like the best per
Right.
se. And that's what got me sort of I was like, went to the psychiatrist and I was like, okay, so which would you recommend? Like, which am I going to respond best to? How much should I take? What time should I take it? Do I take the long release ones? Do I take the short release ones?
Yeah.
All of these questions. He goes, Amy, to be very honest with you, we don't know. And I sort of looked at him at, 1,000, whatever it is,
Yeah.
$500 an hour, and he's just told me he doesn't know. This is sort of this is outrageous. Does he mean he doesn't know?
Yeah.
Um, and he wasn't lying. He doesn't know,
No.
nor sort of anyone really.
Right.
However, I did find and I've sort of tracking everything about myself from like what I ate, how long I slept, what was going on that day, what was my mood, etc. That I could work out and then sort of what medication had I taken, what time had I taken it, what brand was it, all of these pieces of information. And then looking on like Reddit, looking on like every
Yeah.
research paper that you could find, that I was able to work out the right type of medication quicker. And that was super interesting for me. There was definitely patterns there. They weren't, like, bleedingly obvious, but, like, there were trends, etcetera.
Yeah.
And I thought that was sort of I wanted to do that because I had spent so long not okay. I was like, "Well,
Yeah.
this is so exciting. I wanna, like, get to the right stuff as quickly as possible." But it's also very expensive to see a psychiatrist, so many
Mhm.
people or many people don't respond to the first one either. So maybe you have to go to, 6, 7 months of this, and you can't afford that, you don't have time for that. Like, all of these things factor in, and that actually means that somebody doesn't sort of continue a treatment. So,
Yeah.
important that we work out how to get better at understanding sort of treatment response to pharmacological solutions, as well as sort of wider interventions.
And your determination and resiliency really played a piece in that, right? And also, you know, you just realize I'm responsible for my own mental health, and I have to be the primary investigator here. Like no one's going to do it for me, and you can't fix what you don't track, right? Like in so that's really incredible. And see that's another thing that I thought about when I looked at the platform is like the amount of patterns like that you know the the practitioners are going to be able to see, and what the data is going to give to, I mean, the whole medical, system, of treatment is sort of like, okay, this certain geographical, region of the world, in this sort of career, this gender, this, yeah, this family upbringing, and it's sort of, you know, it's it's what you said, or what I read maybe in Dr. Insel's book is sort of like this should have happened, like the type of care that, or data collection, or precision type of measurement that we do in physical, like in allopathy, in medicine, conventional medicine, um should have been done with mental health a long, long time ago. Like, even myself, I have problem with my cholesterol, and I think it's mainly genetic because, I mean, I don't know if I could exercise more or watch my diet more, but that's not working. And it's kind of funny because, I go to, let's say it's called the lipid clinic here, kind of more specialized, where they take a real specialized look at your blood lipids. And, you know, I might say, but you know what? I do this, 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 and this. But they, as physicians, look at a chart and they look at risk factors, and they might say, well, that's all fine and well, Luella. But we're looking at, what we've seen in the data, that we gathered in the last, 30, 40 years. And considering your age and your da da da, and then to list off all these markers, this is why we're suggesting this. And to think that something similar to that can be done now in terms of mental health, this is the medication because of da 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 da. These are your risk factors now. I mean, it's going to change the landscape, um, like so nicely. Like it's just it really makes me excited. So
Me too. Me too.
yeah, yeah. So let's just switch it a bit quickly. In terms of how do you feel about, you know, building relationships now, and building, like, you have a bit of a team here going now. How has that been for you? How good do you feel about your team?
It's funny that you say that. I was just writing like a bio for everybody earlier today, and I was like, damn, this looks good, sort of thing. And like, was incredibly lucky. Sort of, I guess the first point in call was met Suraj, who sort of been a good friend, and we sort of got chatting about how data could be used in mental health care. He is by far and away the smartest person I think anybody who knows him knows. Like, sort of, very different backgrounds with respect to sort of upbringing. He'd been, I mean, parents had earned a sort of a dollar or 2 a day, and by 21, he was earning like 100K, had all his sisters now go to, like, he's got 5 sisters, they're all in medical school, like, I'm just like, genuinely the smartest person anybody who knows him knows. So, completely landed on my foot, and I think on my feet there, and I think in the context of a startup, then you wanna have people who are problem solvers and have grit, and I feel like that is, like, the epitome of it sort of thing.
And so
Um
what role is he playing?
So CTO,
Okay.
and I think something that we've really found, which was it came out in the sort of due diligence that lasted a week or so, um, was people being like, "Well, he's not got like enough of a CTO background," which in many respects is sort of true. You kind of look at it and go, "Oh yeah, no, he doesn't really." I mean, and he does, but not in sort of a conventional. I went to Stanford, I did a master's in computer science, and now I'm here because that's not an option. Like
No.
not even vaguely an option, and it doesn't mean that you weren't it's just that the trajectory doesn't look like that. And so something I'm really excited about is we just got on a head of engineering who has been like like sort of an advisor, sort of slash like part-time, with us for basically since the start now. He's a Google developer expert. He was a CTO at a startup that exited at sort of 300 million or so. And I think that like because he's sort of led high performing engineering teams before that have done incredibly well, I think that that really like ties to sort of Soros's natural intuition and sort of ability to connect different ideas with somebody who's kind of seen it work in the wild before. And so working together, I feel like is going to be just a really, really awesome combination. So
Mm,
he's joining the team. I'm really excited about that.
mm,
So that's, I guess, a bit about the technical side,
mhm.
sort of more sort of scientific, or clinical side, working with Dr. Andrew Schwemm, who's a clinical manager from Lyra Health. It's so nice to work with a clinical psychologist. He makes us all sort of like sort of very much take breaks and be very practice sort of what you preach per se. And he's also been like director at Bellevue Hospital, where he built the clinic that was supporting survivors of 9/11. And it's just an incredible person. He's a direct sort of leader. I don't know if actually it's called director, but for Therapists in Tech, which is sort of a non-profit
Mm.
community, 4,000 therapists. And it's just but just an incredible, credible person. And so being very fortunate on that front, and then from an advisory front as well, just kind of got like people I'm like fans of.
Mhm.
Eh, and having them on our advisory board and having their sort of input and support is just so incredibly lucky. I'm very grateful for that.
Great. Yeah, no, yeah, it's funny you mentioned about, he's trying to, get us to take care of ourselves as we're on this mission. It's easier said than done, isn't it? Because when you're so passionate about something, it's just sort of and you enjoy it. It's like
Mm,
it's like someone pulling you away from something that like you like, well, actually it's an addiction if I feel like that's something that I struggle with sometimes because I just love what I do. But yeah, I think we all need to practice that and exercise it. And that's why I think teamwork is so important because you have outsiders looking in on you, right? Like you have somebody more or less watching your back and you support one another. And the same goes for, I guess, people that start investing in you that they're going to be looking out for you because they got, skin in the game now.
mm,
So it'll be more and more exciting, I think, as time goes on in terms of and to see your support system just keep on building and building and building. Um, so I mean, okay, so maybe we didn't do this really in the right way, but let's just because I'm just thinking maybe we should have explained a little bit more what like in you know like 4 or 5 sentences or less, like how would you describe Allia Health to people that don't know anything about it?
So at its core, we're making it very, very easy, dead simple to collect a lot of different types of data. This could be from like wearable devices, or it could be from like genomics or brain scans that can be in electronic health records. It could be like latent cues, linguistical cues, or vocal cues from how you say things during telehealth sessions. So what we're doing is analyzing all of that, connecting all of these pieces of relevant information together to build like this big knowledge basis. And that allows us to provide recommendations to your therapist, your psychiatrist, etc. It also allows us to answer questions for you as a patient about maybe what's going on, how have things changed over time. But I think sort of very interestingly as well, then by doing this over a large scale over lots of people, then we can find sort of much more data-driven patterns and make recommendations based on patients that have come before in a continuously learning environment, like
Mhm.
learning process, and get
Mm.
constantly better at this.
Mhm.
That I think will be very important for answering questions to say, if you're an insurance company, what is working well, what is not working well, how can we reimburse providers more because they're improving outcomes more, how can we encourage that? If you're a pharmaceutical company, how can we better work out, okay, this group of people is responding really well to that drug,
Mhm.
like, and ultimately tying everything, or incentivizing everybody to improve patient outcomes.
Mhm.
Sorry, that was definitely more than 4 sentences. I thought you said that.
No, it was really well described, like, yeah, very well described. I know I can't think of anybody who's wouldn't be excited about it. The patient, the practitioner, the insurance provider, like you say, the pharmaceutical companies. I mean, there's nothing to lose, and just everything to gain sort of thing. So, hmm. Well, we covered a lot. How can people follow you now? How can people get a hold of you? Is is there even a way of perhaps trialing out the system? Like,
Yeah, absolutely.
okay.
So we're launching publicly the end of this month, and that will be for anybody who's in private practice, like anybody who's a clinician could be in private practice. You could have your like be in a group practice, you could be in a clinic, and working with sort of a number of like really top academic clinics, concierge clinics, bigger sort of health systems, both in the UK and the US for this. And so if that's you, then we'd love to talk. If you are, but also if you're sort of receiving mental health care and you think, oh, I'd be really interested in my provider having access to this information, or I would really like to see you guys do this or this. Like, I think that patients' lived experience and input is like the most gold dust of information. So, so interested. And would love to get that feedback from
Well,
you and see any way we can support.
wonderful. Like, yeah, like as you describe that, I can see that this being the new standard of care. It's either, I'm going to go see a clinician who is using Allia Health, or I'm not going to go. Like I'm going to go find somebody who is, because it's like somebody who's actually licensed and somebody who's not. I think that's what it's going to end up, kind of boiling down to. Because to not provide this type of data and expertise is almost going to be like malpractice or a huge disservice to the client. So I'm super excited, super pumped. And is there any like borders? Like you mentioned US, UK, is this, when you say public, is this Canadian? Is this
Yeah.
European? Yeah.
Any like it works publicly internationally. I guess our focus has been on sort of mostly on the UK and the US, but
Yeah.
very much works internationally. You're in Canada, no problem. Like, so yeah, no problem at all. Just figured from our side, focusing on like small, like geographical areas seem like a good idea to start with.
Mhm, mhm.
But I think actually, crucially, then it shouldn't really matter where you are in the world to depend what yes, it's gotta be culturally sensitive, but, like, in terms of what care you should sort of receive, and this is something that's
Yeah.
got to include care. It's not about making, um yeah, and that is our core focus, so,
Yeah,
yeah.
no, that makes I didn't even think about that. Yeah, it's sort of like, yeah, because you're a human being, you deserve
Yeah,
precise, you know, like evidence-based healthcare. Yeah.
yeah.
So wonderful. Well, you're a trooper. I mean, before we hit record, guys, poor Amy mentioned that she's she's burning the midnight candle because, well, you literally are. Is it not like you're in the UK? So is it like we're
11:30, it's not too bad.
11:30? Oh my God. And when like you arrived when? Like hours before this, I
They
think.
it's
Oh,
so silly,
oh my
but very
God.
exciting meeting tomorrow, so,
Okay.
very pleased to be here.
Okay, okay, great. Well, everyone, yeah, you hear it now. You heard it here on Mixing Business with Pleasure podcast. I think this is going to be the new standard of care in mental health. And anybody wanting to know more, yeah, look up their website, contact me, and I'll be happy to pass the information along. So, any parting words?
Thank you very much. I'm so excited to interview you. We're gonna be starting a podcast soon. Um,
Oh,
really looking forward to it, and thank you so much.
awesome.
Yeah.
Okay. Okay. Great. Well, everyone else, have a great week and we'll see you back here next week. Thanks, Amy. Thanks for tuning in to this episode. Remember that you can watch the full episode on YouTube, where I plan to hang out the most. Your feedback and suggestions for future guests are incredibly valuable to me, so please don't hesitate to post a comment. You are an integral part of this journey.